Hello everyone, I am Dr.Krishna Chaitanya, Consultant ICU in charge from Ankura Hospitals, Nagar. So today we will discuss about the topic like excessive crying in infants. So this is the question which is alarming for most of the parents. So there are multiple reasons for the topic like excessive crying in infants. It's need not to be always taken as hunger or just because of the baby is crying, maybe baby is hungry or just keep on giving more feeds. That's not the reason actually. So one needs to know, one needs to understand the pattern of crying, like why the baby is crying. And because whenever the baby cries, if keenly observed, especially over a time, the parents themselves get trained actually, because not every time the baby cries in the similar fashion. The cry with hunger may be at a different pitch and different tone, and the cry of discomfort maybe at a different way, the baby express it in a different way. So yes, there may be multiple reasons. So we discussed that in like few topics: what are do's, what are don'ts, and what could be the probable reasons, and what is the probable interventions we can do onto them. So like do's, always try to comfort the baby, swaddling and cuddling, try to give comfort, more soothing, a gentle touch. So these are the do's. Don'ts, just don't keep on putting the bottle or nipple into the baby's mouth whenever the baby is crying. Just don't try to keep on feeding the baby whenever the baby starts crying, or don't try to accept yourself, no, that is just because of the hunger cry, baby is crying. So then what are the probable causes for the crying? When it comes to the crying, like the fashion, you always tend to assess from head to toe. There may be probably something problem within the head which the baby may be undergoing, something sudden headache or something problem within the brain baby may face, where you have to keep checking the fontanelle, anterior fontanelle. Is it really bulging out or is it full? That's need to be assessed. Or else then another reason when you come down for the baby causing excessive crying is the nasal blockade. Especially small babies, when they exposed to cold climate because of the nose blockade, because adult pediatric children or adults usually you can know, or they may tend to blow out. But small babies, they are not trained up, they don't even know how to blow out the nose, or else they even just don't know what to do if my nose gets blocked. So they just keep on crying. So whenever there may be some nasal blockade internally because of the very stuffy secretion or all, they just keep on crying. Then when it comes down, there may be something mouth, oral ulcer sometimes because of some viral infections, or because of some antibiotic given, some rash, or because of the nipple, sometimes thrush, some mild infection may flare up, because of which baby may not be able to take feeds, and out of pain they may cry. So that's when come to oral cavity. Then when you go down, something problem with the lungs or something problem with the heart, especially when it goes with the lungs, especially children having some pneumonia type pattern or having some mild infection, bronchiolitis, they may present with excessive crying because there is some breathing difficulty. They are not able to breathe comfortably because the internal pathophysiology is being changed differently than the regular normal breathing pattern. So that adequate oxygenation is not being delivered to the body. So they tend to cry. That's the way they express. Sometimes few children, especially few kids, especially who present with this excessive crying, yes, definitely there may be some cardiac problems even. There are certain cardiac problems which present only with excessive crying symptom. So especially it may be arrhythmias or supraventricular tachycardia, or those children landing up in some congestive heart failure, they present with excessive crying. The other symptoms may be there, but parents tend to ignore them. They tend to overcome them. Just parents, what all they realize is my baby is crying, keeping on crying. But when you evaluate, this child may turn out to be having some cardiac rhythm problem, arrhythmia or supraventricular tachycardia, just heart rate going more than 200, which parents cannot realize. Just parents come with my baby is crying excessively. But when you check it out, your heart rate may be more than 200, and this child may turn out into some having rhythm problems. So at the same time, not to like over jealously diagnose or something, label something very abnormal for even normal baby. So it's always a good and bad bias which you had to make out. What is probably normal, what is probably hunger, what is probably thirsty, what is probably pain. This fashion you have to go. So when it comes out to a little more down from the chest, when you go to abdomen, there comes your abdomen colic, which is most common in pediatrics. So colic comes with like a rule of 3, like more than 3 hours per day and more than 3 days per week, and this continuing for more than 3 weeks. This is called as infantile colic, where babies tend to cry, and for no reason. Parents get in the middle of the night, they were unable to sleep, and baby is not sleeping, keeping on crying and not feeding. And just with time, over the 2 to 3 hours time, baby gets tired. You give some soothing drops or something, baby gets comfort, then sleeps. So this colic especially is common in pediatric age group, especially infants. This is most of the time called as evening colic, which happens especially in the evening to night period of time, where because of that some digestion problem, and that because of the small bowel, their movements and all, baby feel lot of crampy pain because of that smooth muscle contraction. So baby expresses it in the form of the pain with tightening of the abdomen. So this is infantile colic is the one of the differential for that excessive crying. Then when you go still further, baby not passing stool for regularly, hard stool, or abdomen may get tightened, baby may again crying. So whenever that baby cries, just look into the abdomen also. Is it baby is making abdomen very tight, or go into the history, ask the mother whether the baby is passing stool daily or not. That's how you know. Then when it comes to another most important thing where baby cry excessively is, which can be sorted out, is urinary tract infection. So especially infants, where mother keeps on wearing nappy, or male baby who may be having some like a PU valve obstruction or anything, so some rash. These babies tend to develop urinary tract infection and they keep crying. And one more thing, especially for the parents or attenders who tend to wear diapers very frequently or not able to change them frequently, they may develop some nappy rash, which may be due to some fungal infection. They, out of that irritation and all that skin rash, baby may tend to cry. So this is called as like irritant cry or some pain cry. So different cries. So like it may be hunger, it may be thirst, it may be pain, it may be discomfort, it may be something breathing difficulty, it may be something abdominal discomfort, it may be something cardiac problem. So overall, it may be something CNS problem. So overall the problem, when it comes to the infant crying excessively, you need to take a detailed history, you need to reassess by step, then you come out into the conclusion point what could be. Then you come, what are the interventions you could do. Yes, when you feel based on the history, baby is having fever, and when AF is bulging and all, when you suspect something problem with the brain, especially send them to the any referral center, pediatric center. The child needs to get evaluated, child needs certain workup, maybe even needs admission. Then if it is all okay, when it comes out of just when you check nappy, something problem with the abdominal discomfort, you tend to sort it out to be something colic or something nappy rash or something, you treat accordingly. If it is colic, you reassure them, give some soothing drops or some drops to release that carmicide drop you give, or simethicone drops you give. So to reassure the parents that's okay, it is going to be part of the thing, that's it. And if it is like nappy rash, give some ointment or something soothing for something nappy guard rash which you give. That's how you treat. So if it is something breathing difficulty you feel, or something odd with the chest, or something new sounds you could see, something problem with the heart rate you assess, then child needs particularly like ICU intensivist examination or some cardiologist examination, and treat accordingly whatever that comes in the pathway. So you every time whenever child presents like excessive crying, don't take it guaranteed, go for a detailed thorough examination, and as you get the outcome, then if you treat the if you intervene at the right moment, the outcome will be very good.